All right, welcome to this video. We're going to talk about understanding your DEXA body composition results. This is a guide to actionable health goals. Yep. There we go. So in this presentation, we'll be exploring the power of DEXA body composition analysis and how it can help you create personalized health and fitness plans. So whether you're just starting your fitness journey or if you're looking to fine-tune your existing routine, this presentation will provide you with some valuable insights on interpreting your DEXA results and setting actionable steps towards your goals. By the end of this presentation, I'm hoping that you will understand the significance of body composition analysis, and you're also going to learn how to interpret your DEXA results and discover how to set SMART goals based off of those results. We're also going to discuss some practical steps in decreasing visceral fat, increasing bone density, improving your lean mass and muscle symmetry, and basically just how to utilize your DEXA results to guide your nutrition as well. My goal is that this video will help you, whether you have a DEXA scan with us or with someone else, right? Or even if you haven't decided yet if a DEXA is right for you. So let's get started. So what is DEXA? So DEXA stands for dual energy X-ray absorptiometry. It's a highly accurate imaging technology that provides detailed information about body composition. It's considered the gold standard in body composition analysis due to its accuracy and reliability as well. And DEXA is widely used in medical settings for diagnosing and monitoring osteoporosis. All right, so where do I get a DEXA? What should I be looking out for? So there are three factors to consider when deciding where to get a DEXA body composition scan. So first of all, to ensure accurate results, it's important to, well, you should just know that a DEXA scanner has to be looked at by a physicist. It has to go through at least annual maintenance and preventative maintenance checks as well. So you want to have a facility where your machine is well maintained, the equipment's well maintained, and you have knowledgeable technicians and technologists as well. So the DEXA scanner is also required that it is perfectly leveled by an engineer. It has to be regularly calibrated and undergo professional maintenance whenever it is relocated. It needs to be leveled, right? And it has to go through a complete maintenance routine after it's been moved as well to ensure its accuracy. So let me just tell you a little story, a little example on this. When we moved our location, we moved our DEXA scanner. Basically, it took our engineer, it took him 6 hours to get our machine perfectly level. Now, mind you, this is on a concrete floor, and it still took him all that long. There's a lot of different things that have to be very precise about the machine to make sure that it's accurate correctly. There are the image tower slides on a metal track as an example. And if this track is slightly off, it causes vibrations. And we've actually seen it pass our quality assurance checks, but it fails on the deeper tests that only an engineer who does the professional maintenance can test. So this is important because it means that even if the tech is doing the required QA testing, the machine may not be calibrated correctly and can be off balance. And an off balance machine can cause unreliable scan data. Like I said, there's also technician factors. The technician that operates the DEXA scanner should have proper training and certification. They should have knowledge of correct body positioning for the scans. They should understand how to do and use post-processing, as well as radiation safety and how to interpret the results. At DEXAFIT Seattle, my wife and I are both registered radiologic technologists. We've worked in the field combined for over 40 years, myself 28, 29, lost count. long time. And then also important is like client and prep factors, right? So basically you should follow pre-testing protocols that should be given to you. It includes some fasting. It includes avoiding like heavy workouts prior to the scan, and also maintaining proper hydration as well. All right. So what do you get from a DEXA scan, right? So a DEXA is going to provide some important measurements related to your health, such as accurate body fat percentage, the android gynoid ratio that compares fat distribution in your body, a visceral fat measurement, lean mass analysis, and for muscle symmetry as well, bone density assessments, and more. Now, understanding your body composition is crucial for setting realistic health and fitness goals and for tracking your progress. So it goes way beyond weight, right? Because weight doesn't tell the whole story. It's not just about how much you weigh, but what that weight is made up of. Two people of the same weight can have very different levels of body fat and muscle mass, right? And so by focusing on body composition instead of weight, you can gain a more accurate understanding of your health and fitness. So next, I'm going to just kind of touch on each of the main categories of your DEXA report: fat, lean mass, belly fat, and bone briefly. And then I'm going to kind of go back into each of those. We're going to take a little deeper dive into why these matter, how to interpret your report, and what to do with that information. All right, so body fat percentage, right, is the proportion of your total body weight that is fat. And DEXA provides a precise measurement of body fat, including subcutaneous and visceral fat. The android gynoid or AG ratio compares fat distribution in the central android region to the hip thigh, which is the gynoid region. And the reason for this is that a higher AG ratio is associated with increased risks of conditions like heart disease and diabetes. And then bone density is critical for overall health, and DEXA is the gold standard for measuring it. Your T-score compares your bone density to that of a healthy young adult, which helps to diagnose and monitor osteoporosis. So on our graph and our report, you can see exactly where you are at and where you fall from that starting point of osteoporosis. And then lean mass is the weight of everything in your body that isn't fat or bone, right? So it includes things like muscles, organs, blood, cartilage, tendons, and skin as well. Now, primarily, its lean mass is going to be made up of muscle mass. And the nice thing with the DEXA 2 is that those other things don't really change from scan to scan. So the changes that you're going to see are going to be how much muscle have I gained or lost. And DEXA provides a detailed breakdown of lean muscle mass, which is also important for evaluating muscle symmetry and tracking changes due to exercise or aging. So your DEXA results from DEXAFIT Seattle will also include measurements like FFMI, fat-free mass index, and ALMI, which is your appendicular lean mass index. And these help assess muscle mass relative to your height and diagnose for sarcopenia, which is a condition characterized by muscle loss. So although most facilities do not include this information, it is relatively easy to calculate yourself. So in the next section, we'll dive into the health implications of these measurements and discuss some actionable steps to help you improve them as well. All right, so visceral fat. So visceral fat is the fat that's stored deep within the abdominal cavity. It surrounds your internal organs, and high levels of visceral fat are unfortunately associated with a greater risk of serious health conditions. These include heart disease, type 2 diabetes, high blood pressure, certain cancers, and Alzheimer's disease. So, it's not just about our appearance. because reducing your visceral fat can significantly improve your health outcomes. Now, the good news is that you do have the power to reduce your visceral fat levels through diet, exercise, and lifestyle changes as well. So let me break these down a little bit. So healthy diets, right? So consuming a balanced diet that's low in refined sugars, saturated trans fats, saturated and trans fats, is high in fiber, can help reduce visceral fat, as well as just you have to limit calorie intake. Also, by limiting processed foods and beverages high in sugar is also beneficial. Regular exercise is helpful, right? So physical activity, especially aerobic exercise and resistance training, can help reduce visceral fat. And then just weight loss alone, right? So if you're overweight, losing weight can help reduce visceral fat. What's cool is that even a small amount of weight loss can lead to significant reduction in visceral fat. Reducing stress. I'm going to go into some of those lifestyle changes, right? So reducing stress. High stress levels can lead to weight gain and an increase in visceral fat. So stress management techniques, things like yoga or meditation and mindfulness, can help. And then sleep, right? So lack of sleep is linked with increased visceral fat, and ensuring that you get enough quality sleep can help as well. Limiting alcohol can help in managing visceral fat levels. Quitting smoking, if you do smoke, quitting can reduce your visceral fat and improve your overall health as well. So in the next section, we'll discuss the importance of bone density and how you can work to improve it. So what is bone density? Bone density is the amount of bone mineral in your bone tissue, and it's a crucial factor in your overall health, okay? Because low bone density can lead to conditions such as osteoporosis, which we've mentioned, which weaken your bones and increase the risks of getting fractures. And as we age, maintaining bone density becomes even more critical to prevent falls and injuries. So fortunately, there are steps you can take to increase your bone density as well. So even if you get your DEXA, you see a low bone density, there are things that we can do to increase it. All right, no matter what age you are, by the way. So weight-bearing exercises. So think of weight-bearing exercises as activities that force you to work against gravity, such as walking, hiking, jogging, climbing stairs, I don't know, playing tennis, even dancing, right? And also resistant exercises like lifting weights are one of the most effective ways to increase bone density and strength as well. Balanced diet, yes, because your diet plays a significant role in bone health, right? Consuming adequate amounts of calcium and vitamin D is essential. Calcium is like a building block of bone, and vitamin D helps your body to absorb the calcium. There's other nutrients as well, even protein, but magnesium, vitamin K, and omega-3 fatty acids also contribute to bone health, okay? And then, yeah, lifestyle choices here too, right? Avoiding smoking and limiting alcohol consumption, both can decrease bone density and increase your risk of bone fractures. So look, in some cases, medications might be recommended to increase bone density, particularly if you're an individual that has a high risk of fractures, like having osteoporosis. So in the next section, I'm going to delve into muscle mass, its importance, and how you can work to increase it. All right, so lean mass, which primarily consists of muscle, is not only important for physical strength and functionality, but also plays a critical role in your overall health and fitness and longevity, because it plays a significant role in your metabolic health, right? Because lean mass contributes to a higher metabolic rate, which means that your body is burning more calories even at rest. And this can help maintain a healthy body weight. Muscle mass helps with insulin sensitivity. So having higher lean mass improves insulin sensitivity, which is essential for maintaining stable blood sugar levels, improving insulin sensitivity also reduces the risk of developing insulin resistance and type 2 diabetes. I don't think it's talked often enough how important lean mass is for these types of things, insulin sensitivity and type 2 diabetes. We talk about food and high carbs and sugar spikes, but really muscle is a buffer for all of that. And then bone health, right? Lean mass supports bone health by providing a mechanical stimulus to bones through muscle contractions. And this helps promote bone density and strength, right? Reducing the risk, again, for fractures and osteoporosis. And very importantly is for mobile, mobility, right? And independence, because maintaining lean mass helps preserve muscle strength, functionality, promotes mobility, and independence as you age, reducing your risk for falls, enhancing balance, and then also supporting your ability to enjoy the activities that you want to do, right, for your daily life. Lean mass is important for disease prevention because adequate lean mass is associated with reduced risks of various chronic conditions, including cardiovascular disease, metabolic syndrome, and even certain cancers. Lean mass also supports a healthy immune system, contributing to a better overall health and disease resistance. And of course, kind of touched on this, but your quality of life, because having sufficient lean mass improves your overall quality of life by enabling you to better, you have better physical performance, higher energy levels, and vitality. So regular resistance training and proper nutrition are key to increasing lean mass. So let's talk about muscle symmetry. So muscle symmetry refers to the balance in strength and size between different muscle groups in your body, particularly between the left and the right sides is what we're going to be focusing on here. And achieving muscle symmetry is important for preventing injuries because imbalances can lead to improper movement patterns, which increase the risks for strains and injuries. Also for improving performance, symmetrical strength can enhance athletic performance, but also day-to-day functional movements too. It also helps with promoting postural balance. Muscle balance helps maintain proper posture and reducing the risk for chronic pain and discomfort. All right, so building lean mass and improving muscle symmetry, look, it primarily involves strength training and proper nutrition. So resistance training, right? Regularly performing exercises that make your muscles work against resistance, such as weightlifting or body weight exercises can help increase muscle mass. And then proper nutrition, particularly we're going to be looking at protein here, right? Protein is crucial for muscle growth and repair. And you want to aim for about 0.8 to 1.2, maybe even 1.4 grams of protein per pound of your lean mass, not per pound of body weight, per pound of lean mass. That's going to really dial that in for you. And that's a good general guideline. All right, improving muscle symmetry. How do you do it, right? So it's going to involve some targeting exercise and also just some conscious movement. So you can do balance training. And you want to ensure that your workout routine trains both sides of your body equally. You want to incorporate unilateral exercises as well, that those that work like one side of your body at a time to help balance out any discrepancies. You should be doing some mobility work because regular mobility work and utilizing lateral and dynamic movement patterns can also help improve symmetry. If you have significant imbalances, working with a physical therapist can be very beneficial. And then lastly, and maybe most importantly, is just being mindful and having an awareness of any asymmetry you may have, as well as your posture can help correct imbalances. And also bring awareness to activities that you may be doing that are the cause. Right? For example, it could just be things, simple things like the way you stand or maybe the way you carry things. All right, so let's talk about setting SMART goals. So This is an effective approach for turning your aspirations into actionable steps. So SMART stands for specific, measurable, achievable, relevant, and time-bound. So let me dive into each one of these. So specific, your goal should be clear and well-defined. Measurable, you should have a way to track your progress and know when you've achieved your goal or that you're moving in the right direction. Achievable, your goal should be realistic and within your capabilities. It should be relevant. Your goal should be important to you and fit into the broader health and fitness objectives that you may have. And it should be time-bound, right? Your goal should have a deadline that helps keep you motivated and focused. Let me show you how your DEXA results can help you with this, because they offer a wealth of data that can help set up these SMART goals. So let me just give you a couple examples of how. So specific, right? So instead of saying, I want to lose weight, your goal could be, I want to reduce my body fat percentage from X percentage to Y percentage, right? Just one example of a specific. It could be a visceral goal. It could be a lean mass. It could be a bunch of the different things that we've talked about. Measurable, right? Your DEXA scan provides precise measurements. So by getting regular scans, you can track your progress quantitatively. Achievable, knowing your current body composition helps you set realistic goals. So for instance, if your DEXA results show high visceral fat, your goal could be to reduce them by a specific percentage or specific amount of weight. Relevant, your DEXA scan can help identify the most relevant goals for you, right? So if your scan shows low bone density, for example, a relevant goal could be to increase your bone density. And then time-bound. So DEXA scans can be repeated to monitor progress over time, helping you to set timelines for your goals. I personally like to just book mine in every 3 months. I suggest every 2 to 3. If you are working on something, you may not need as frequently if you're kind of just maintaining things. But if you're working towards something, you want to get them probably 2 to 3 months. But I don't recommend doing more often than that. So in the next section, we'll look at how you can take action on these goals and also the resources that are available to support you on your journey. All right, so armed with your DEXA results and your SMART goals, you can begin integrating changes into your diet, exercise routine, and lifestyle. And you can create a personalized health and fitness plan, tailor your nutrition, align your workouts with your goals, and also maybe consider other lifestyle modifications. So for example here, diet, right? You can tailor your nutrition to support your goal. So if your goal is to increase lean mass, you want to ensure that you're consuming enough protein. And I already told you how you could use your DEXA to ensure that, all right? If you aim to decrease visceral fat, you might focus on a balanced diet rich in whole foods and limit processed foods and alcohol, all right? So just some examples of how you might use your DEXA to tailor these specific areas. So exercise, right? Your workout routine should align with your goals. So if you're focusing on bone density, and you want to make sure that you're incorporating weight-bearing exercises. If you're working on muscle symmetry, you want to make sure that you're targeting exercises to balance out any discrepancies. And then for lifestyle, you might consider other modifications that support your goals. This might include like reducing stress, improving the quality of your sleep, or reducing alcohol intake. So as you saw, many times we can tackle multiple areas and goals with just a couple of simple actions, as often they do interact and overlap with each other. So at DEXAFIT Seattle Fitness Lab, we not only offer regular DEXA scans, but also professional guidance and a supportive community to help you achieve your health and fitness goals. We offer other services at DEXAFIT Seattle as well. We do resting metabolic rate tests. We do 3D body measurement and posture scans. We do VO2 max cardio tests. And we can also put programs together to help you put it all together for you. Remember, the journey to health and fitness is usually it's a marathon and not a sprint, right? And I think it's important to celebrate each step forward and stay consistent, because in the end, the greatest achievement is not just reaching your goals, but the improved health and well-being that you'll enjoy along the way. So thank you. Again, you can contact us. We are DEXAFIT Seattle at 111 West John Street. That's Suite 203A. We are located in Lower Queen Anne. You can see the Space Needle from our building. You can also call us at 206-268-0700. And you can schedule through our AI text system, or you can visit our website at DEXAFIT.com or bodysciencecoach.com, and you can learn more about us and also schedule your DEXA scan or any of our other tests that way. So again, thank you for joining me today as we explored the power of DEXA body composition. And your DEXA results really offer a personalized roadmap to health and fitness. And we're here to support you on your journey to improved health and well-being. And we look forward to seeing you at DEXAFIT. Remember, every step counts on your journey to a healthier, fitter, and more fulfilled life. Thank you.